Dear future citizens of space, this is an Earthling, Spirit Crest, signing in on the date of October 18, 2015. I'm here to record a digital time capsule for you all, informing you on an important skill that one day may be lost. This video is medical related, regarding the tools used to measure blood pressure, how it is measured, and how to interpret the results. This is an important skill that every medical space resident should know. If one day the space station were to lose all technological advances, this simple procedure could be of help in saving some lives until technology is restored. The first thing necessary are tools. The tools required for this procedure are few. Instead of futuristic technology that may be quicker, such as body scans or other tactics developed to measure blood pressure, these simple tools are manual but may be even more precise. So the first tool used to measure blood pressure is called a stethoscope. This tool consists of two earpieces connected to a metal ear tube. The metal ear tube attaches to another tube which connects to a chest piece. The chest piece acts as an amplifier. It amplifies sound such as pulse and heartbeat. The next tool used is called a sphygmomanometer. This tool consists of an arm cuff which inflates with air and puts pressure on the arm, a squeeze bulb which inflates the arm cuff, and a gauge to measure blood pressure. With these tools, we're capable of measuring blood pressure. Assuming that technology performs these blood pressure tests differently or not at all, I'm going to assume that some residents of space do not know much about blood pressure. But first, to know how to measure blood pressure, we must first know what it is. So BP is the pressure of blood in the circulatory system, and those who study medicine will know what that term means. The reason for measuring BP is because this tells us a lot about the rate of the heartbeat and the artery walls. So to begin, it is easier if one practices on another. However, in this demonstration, it is just I. First, the arm will be extended, palm up. Next, we will take the cuff and place it on the arm, above the elbow, on the bicep, against bare skin. This allows for a better reading. After that, we will take the stethoscope earpieces and put them on and place the chest piece on the antecubital region of the arm, also known as inside the elbow. Next, we will hold a squeeze bulb in the other hand. I'm then going to inflate the arm cuff, but first I must check the bulb. The knob on the bulb, turning it to the right, tightens the tube and inflates. Turning the knob to the left, loosens the tube and deflates. Next, I will wash the gauge and inflate to approximately 160 millimeters of mercury. Inflating over 180 millimeters of mercury can cause damage to the patient's arm, pain due to overinflation. So once I pump to 160, I will slowly twist the knob to deflate and listen with the stethoscope. The first pulse sound is the top number in BP over the last pulse sound, which is the bottom number. If it is difficult to hear, you can also watch the needle in the gauge. The needle hesitates with every pulse. So I will later explain what these numbers mean. The top and bottom numbers are the results of the blood pressure test. To interpret blood pressure, we must know what these top and bottom numbers mean. The top number, which is a large number, is systolic. This measures the pressure in the arteries with every heartbeat. The bottom number is diastolic, which would be the smaller number. This measures the pressure in the arteries when the heart is between beats and resting and filling back up with blood. Low blood pressure is considered to be 90/60 in adults. In children, this is normal since they are smaller. We also expect these numbers to be smaller. Normal BP is considered to be 120/60. High is 160/80, and emergency blood pressure when one should contact their doctor immediately is 180/110. High BP is a sign of cardiovascular disease and is a serious condition. Knowing how blood pressure works and how to manually measure it is an important skill that everyone must know. Knowing what tools you need, how to measure BP, and what the results mean is an important skill for human health. So future residents of space, I encourage you all to please keep in mind what you have learned in this video. We should not always rely on machinery for blood pressure tests. Manual readings will have a better chance at being correct. This is Spirit Crest signing out.